end range pain occurs in both in the active movement testing and in the passive movement testing. We have to ask, why does it hurt? Which structures can be affected and which muscle can be affected? We go now through this very structured.
자, 지금부터 뭐 할 거냐면은 저 자세로 가능한 할 수 있는 만큼 이렇게 팔을 뒤로 올렸을 때 우리가 알고 있는 통증이 어깨랑 팔꿈치에서 일어났습니다. 엔드레인지에서 이제 페인도 있고 그러면은 근데 이제 액티브로도 하고 패시브로도 했는데 양쪽 다 이제 엔드레인지 페인이 있었고요. 그때 우리가 어떤 구조물이 영향을 받았는지 어떤 머슬이 영향을 받았는지에 대해 생각을 해볼 겁니다.
We made it together step by step because third course day evening we are all tired a little bit, and so we have to see how is it possible to manage that question in a proper way.
우리가 어제도 이렇게 했었던 건데 이번에도 그냥 천천히 한번 생각을 해볼 겁니다.
As example for clinical reason.
네, 그 클리니컬 리즈닝 임상 진단의 예로 쓸 수 있는 건데.
So, which structures can be affected?
어떤 구조물 영향받을 수 있을까요?
Yes, I start as you. I ask, could it be joint? Yes or no? Yes. Then second, could it be a myofascial problem? Yes or no? Yes, it could be. Could it be a neural problem? Yes or no?
신경은
We don't think so. Why? It's the same reason. There is no stretching of a neural structure, no compression of a neural structure. I think it will not be a neural problem. Could it be something else?
그 다음에 또 어떤 걸로 생각할 수 없죠?
It could be, but I don't know. It's not often that there is another reason, but it could be a tumor. It's every time is possible something else, but it's not well known. It's not often, and we deal first with the things which are often. So I have to think it could be a problem with a joint. It could be a problem with a muscle. This is clear. Okay. So we follow to the second question in this course. We favorize the myofascial hypothesis and we ask which muscles, which muscle group could be affected if it hurts in this movement in the shoulder, elbow.
그래서 아까 말했던 뭐 조인트나 신경 이런 것도 맞다 이렇게 우리가 어제 얘기를 했었습니다. 그 다음에 또 뭐가 이렇게 마지막 질문으로 그럼 그거 말고 뭐 있을 수 있느냐라는 질문에는 이제 본인 스스로 그건 모르죠. 우리가 이제 오픈룩으로 이렇게 과외자에게 봤을 때에는 또 여러 가지 구조물로 인해서 발생을 할 수가 있으니까 그러면 우리가 이제 이번 코스에서는 결국에는 머슬하고 파샤의 그 기준을 두니까 머슬이라고 생각을 했을 때 어떤 머슬이 영향을 받았고 어떤 머슬 그룹이 영향을 받았는지 한번 얘기해 봅시다.
I see at the test end-range pain during the end-range pain by active testing and also by passive testing. So, will it be a muscle which is active or a muscle from the muscle group which is stretched? Can you just decide this or is it too early?
빨리 결정을 해보는 겁니다. 이렇게 딱 했을 때 어떤 근육이 수축을 하고 어떤 근육이 스트레칭이 되는지.
숄더랑 엘보 둘 다 동시에 통증이 있어야 된다는 건가요? 아니면 따로따로 상관없다는 건가요?
He asked can we think like just end range pain or end range pain with shoulder and elbow?
No, elbow you see there is no end range motion. It's in a middle position. It's not end range flexor nor end range extension. It's clearly just end range for the for this movement of the shoulder. We make just the shoulder analysis. The other would be not necessary to put it here behind. I can make this easier in this position. It doesn't make sense to practice it here. So we focus just on the shoulder.
Deltoid. Deltoid.
I propose not to jump to muscles. I propose to jump to muscle groups, to functional groups, and to think, could it be affected a muscle in the group of the active muscles, or will it be a muscle in the group of the stretched muscles, or both? What do you think?
일단은 성기 선생님이 질문한 거에 대해서 답변을 방금 물어본 거는 근육군에 대해서 이렇게 생각을 해보라는 거고, 그 다음에 일단은 팔꿈치는 엔드레인지까지 간 게 아니기 때문에 지금 여러분들한테 나오는 답변을 어떤 걸 원하시냐면은 일단 숄더에 관련된 근육이어야 되고요. 아직까지는 지금 우리 디스커션에서는. 그리고 바로 한 특정 근육으로 넘어가지 말고 뭐 우리 어제 했던 익스텐서라든지 뭐 이렇게 그룹으로 되어가지고. Possible make scapular downward rotation.
So you think it's a muscle which is active?
액티브 되는 거 어떤 거죠?
Yeah, you're just by the muscles. I would propose first to clarify the question. Is it a muscle in the muscle group which is active, or a muscle in the muscle group which is stretched?
그러니까 명확하게
그 지금 제가 생각할 때 그런 거죠. 액티브 모션에도 엔드레인지 통증이 있었고 패시브 모션에도 엔드레인지 통증이 있었다면 액티브 그룹의 문제냐 아니면 스트레치 그룹의 문제냐 이걸 물어보시는 거예요.
그 중에 어떤 거를 자기 의견이
다운워드 로테이터가 지금 액티브가 되는지 스트레치가 되는지를 물어보시죠.
아 그러면 액티브.
You think it's an active muscle, or do you think it's a muscle which is passively stretched in this provocation?
I think stretch muscle group above the rotator.
Okay, we stay now in this question first. We have to decide, is it a muscle in the muscle group of the stretched muscles, or is it a muscle in the muscle group of the activated muscle which performs this?
I think stretching.
Yes, okay. This we discussed yesterday. If actively it hurts, it could be a stretched muscle or an active muscle. But if passively it hurts in the same way, it can't be the active muscle group because the therapist makes the movement, so it will be a muscle in the group of the stretched muscles. We agree? Great. So I have to ask as next question, which muscle groups are stretched in this movement?
Abductor.
Abductors, okay. And then it's good to stay in this group and to say you make an adduction, so the abductors could be stretched. Okay. Which abductors do we know?
우리 어느덧 안 해도 모르죠.
Supraspinatus and deltoideus. Now we have the deltoideus in this group. And then you continue. Is it just an adduction, or are there other muscles probably stretched?
어느덧 말고도
Exactly. You make an internal rotation, so it could be also the group of the external rotator. Which external rotator we know? Infraspinatus teres minor. Okay. We perform making this movement not just an adduction and an internal rotation. We perform also an extension. So it could also be a flexor. Which flexor do we know? Flexor, deltoideus, delta again. Great. In Europe, most people forget the coracobrachialis. I'm happy you know it. So coracobrachialis could be and this is just the next layer of movement. You are right, but clinically, from a clinical point of view, the serratus you can more or less never stretch provocation, and it's just the niveau of the between thorax and the scapula, and we analyze now just the scapulohumeral joint. It's tricky enough for us to learn.
그래서 세라투스도 기능적으로는 맞는데 스트레칭 되는 포지션까지 보려면 이제 흉추에서 움직임도 포함이 돼야 되니까
But
지금
we ask
G
which muscle makes flexion and could be stretched by this extension. We have the deltoideus and we have the coracobrachialis. This is the most important thing. But who makes flexion too? Biceps, the caput longum. And then we have to think, is this muscle stretched in this position? Yes or no?
No.
Not at all, because here it's shortened. Huh? So it's a flexor, but not stretched in this position. So we can say this is not the problem. And the ventral one part of the pectoralis major makes also flexion, but it's the same. The pectoralis major would be stretched in this position, and here it's an adduction, though he makes flexion, but it is not stretched in this position. But now we have several muscles. It could be deltoideus, supraspinatus, coracobrachialis, infraspinatus, teres minor. Where do you start? We don't know. So we have to make a supplementary examination. May I show? You made it yesterday, great. Continue. And today, please with the back to the colleagues. Oh, like this is perfect. You perform this movement, you go back. Does it hurt? Yes. Where? Shoulder and elbow. Shoulder. Yeah, okay. You come back. Does it hurt? Yes. And here? No. Yes. And again? We test the test. We make it 3 times. And then third time, I go here. If you can't see very well, please stand up and then it hurts in this position, and we go back away from the pain. Does it hurt now? Then we go here. Arises the pain again? Yes. Okay. This was what we analyzed. It is a muscle in the stretched muscle group, and we made a list of the muscles. And then I would prefer perform this movement 1 and movement 2. Which movement makes the pain 1? Here more pain. So which muscle group jumps up? Exactly, the rotators. Then you have the focus of the external rotators. Which muscles? Infra, teres minor. Then please on the bed and you will treat it. But if this doesn't hurt more, but this hurts more, it's which muscle group? Delta supraspinatus. And if he says, oh, it's both equal, this and this, I would perform like this. You see the difference? This was before, and now I make this. Huh? It's extension. Huh? Okay. Then it would be coracobrachialis or delta. Great. So I adapt these tests up to the point I have 2 or 3 muscles, because by palpation, this I can make without problem to make the palpatory diagnosis in 2 or 3 muscles. But with 7 muscles, I don't know where to start. I spent too much time. Thank you very much. Okay, great.
어제 했던 검사법을 이용을 할 수가 있는데 우리가 방금 디스커션 할 때 일단 7개의 근육을 의심을 했는데 그 7개를 다 팔페이션 하려면 뭐부터 시작해야 될지도 모르고 너무 많아서 이렇게 움직임을 통한 펑션 테스트를 먼저 생각했습니다.
Okay. So, diagnosis of myofascial problems. Where do we need to treat? How do we know where to treat? This is challenging. And we know we have these techniques, we want to work with these techniques, but where can we apply these techniques? And the treatment needs time, so it's important to know where will be the best effect if there is a problem.
그래서 문제가 생겼을 때 어떤 거를 적용할지를 잘 알아야 돼서 조금 시간을 투자를 해가지고 검사하는 게 오히려 좋습니다.
You can make less light. Thank you. Okay, a good treatment, but not on the right cup.
좋은 치료였지만은 정확한 곳을 이렇게, 치료한 게 아닌 그런 예를 보여주는 거죠.
So we have to look where is the right cup. What can we do? And this is a question of findings. How to find trigger points. We have 2 steps to perform. First, we have to know, to identify the muscle in which the active trigger points are located. And secondary, we have to identify the active trigger points in this muscle. But we have 2 steps. We have an overview examination and we have a detailed examination. The overview examination has 2 goals. We want to gain the focus and where to treat, and we want to get an assessment parameter that we can see how does it work when we work. So the focus means is it a joint, muscle, nerve or another problem, and the assessment parameter means I am able after the therapy to control is there a changement or not, and so to re-evaluate my hypothesis, and so to see am I on a way which I want to follow, or do I have to change my course?
이렇게 해서 말씀드리자면은 오버뷰 이그제미네이션 같은 경우는 왜 시행을 하는가 간단하게 어디에 트리거 포인트가 있는지 어디에 문제가 생기는지 확인하기 위해서, 그리고 만약에 트리거 포인트가 예를 들어 생겼으면은 그게 정확하게 어느 위치에 있는지, 그러니까 어느 구조물인지 그 구조물이라면은 그곳에서 어느 포인트에 문제가 있는지 확인하기 위해서 집중적으로 시행을 하는 게 목표입니다.
And then if we have the focus, we know in which muscle group we have 2 or 3 muscles. Then we jump to the detailed examination, and there is the goal to identify the structure which is involved for the problem. Is it joint, muscle, nerve, or other problem? And this diagnostic we make by palpation. This diagnostic we make by screening tests.
그래서 여기서 어떤 구조물에 대해서 접근을 해야겠다라고 이제 판단을 하고 디테일 이그제미네이션을 팔페이션이나 스크리닝 테스트 이후에 팔페이션으로 이렇게 진행을 해가지고 여기서의 목적은 이제 그거를 확인하는 거죠. 가설 검증의 개념이라고 생각하시면 되겠습니다.
In the detailed examination for the muscle, for the trigger point, we follow which criteria, how do we identify the trigger points we are looking for, first for the taught way.
자, 우리 세 가지 진단 기준이 뭔지 물어보는
Then we are
내용이죠.
looking for the spot tenderness, and then we are looking for the pain recognition. This is this part. But before we can perform this part, we have to get the knowledge, where is the focus, where is the problem, by screening tests. And the rules for these screening tests are common things first.
일반적인 것부터 먼저 하는 겁니다. 일반적부터.
And make everything as simple as possible, but not simpler, says Mr. Einstein.
모든 것을 이제 가능한 간단하게 만들 때 이제
So we try to perform this test as simple as possible, that we get the information and not too complicated, and if it works, and if it doesn't work, we might have to change it a little bit.
네, 간단하게 이렇게 뭔가 문제점을 찾는 거는 해야 되는데 이게 또한 간단하지만은 않은 게 만약에 이게 좀 바뀌면은 문제점을 가설을 세우는데 그게 아니라면은 언제든지 또 바꿔야 되니까 그게 이유라고 있습니다.
The diagnosis of myofascial problems using shoulder pain as example.
예를 들어가지고 이제 숄더 문제를 들어가지고 마이오파시아 프로블럼을 이제 진단하겠습니다. 진단하는 시간을 가질 거고.
In the overview examination for the shoulder, we look for the active range of motion, the resistance testing, the passive range of motion, and the demonstration of the symptom provoking situation.
자, 오버뷰 에그자미네이션으로는 아로에 검사하고 저항 검사하고 패시브 아로에 검사하고 이제 자극 증상 유발 검사를 통해서 진행하겠습니다.
Most often, the patient demonstrate during the anamnesis, during the history, this symptoms provoking situation. They say it hurts more when I make this or this or this or this, and so we know just this symptom provoking situation. If he doesn't show this spontaneously, then it's a good thing to ask after or before this testing which situation provokes your pain in your everyday life to know such a test.
그래서 요거를 바로 이렇게 진행을 하기 전에 예를 들어서 환자가 왔는데 뭐 할 때 아프세요 이렇게 하면은 환자가 한꺼번에 막 이래가지고 뭐 여기 할 때도 아프고 저기 할 때도 아프고 항상 아프다 뭐 이런 식으로 얘기를 할 수도 있습니다. 그래서 그냥 이거를 먼저 바로 물어보기 전에 요거 하고 그 다음에 물어보는 게 좀 더 깔끔하게 우리가 프로세스를 만들 수가 있다고 합니다.
Yes. And then we follow a clear schedule how we perform this test. Here is a possibility how to perform it. You don't have to make it exactly this way, but it is very useful to find his own way to make this every time repeatedly again equal.
자, 요런 이제 방법을 이제 우리가 제시를 했는데 꼭 이렇게 따를 필요는 없다고 했습니다만은 자기가 생각했을 때 요런 순서나 이 방식을 따르는 게 다시 뭐 자세를 힘들게 바꾸고 반복을 해야 되고 이런 게 가장 줄어드는 상황이라고 자기는 제시를 했습니다.
And at minimum, it should make part of this overview examination the flexion, the abduction, the external rotation, and bring the hand behind the lower back, which is internal rotation, and bring the hand behind the neck.
그래서 이런 순서가 이제 동선이 제일 깔끔하더라라는 내용이고요.
And who was yesterday in the evening here with the patient demonstration? I performed exactly this maneuvers.
그래서 어제 이제 데몬스트레이션 한다고 이제 롤플레잉을 했을 때 그 환자분들한테 자기는 이제 이런 형태로 거의 정확하게 진행을 했었다고 했습니다.
Then we should perform the scapular setting in open chain testing of scapular position and in closed chain testing. This we did before yesterday because of the time.
요거는 스캐폴라 세팅에 대해서 이제 OKC에서의 검사와 CKC에서의 검사인데 어제는 시간이 좀 부족해서 이거는 하지 않았고요.
And then we make the resistance testing for the external rotators, for the internal rotators, for the flexors, for the extensors, for the abductors, for the abductor and external rotators, and for the adductors and internal rotators.
이렇게 저항검사 external, internal rotation에 대해서 적용을 했었고 요거 같은 경우는 abduction 하는 거고 이렇게 abduction이랑 external rotation을 같이 검사 여기서는 이제 internal rotation이랑 adduction이랑 같이 검사하는 경우.
And it's very fruitful to perform these tests of resistance because if this test is positive, you have a shortcut. You just know the muscle group which is active there. You have to look for trigger points.
요렇게 하는 게 이제 지름길이라고 합니다. 어디가 문제가 생겼고 어디 트러블 포인트가 생겼고.
And in this resistance testing, there are two symptoms important. One is pain, and the other is weakness.
그래서 통증이나 약화에 대한 문제가 발견될 수가 있고.
And sometimes there is just pain without weakness. Sometimes it's just weakness without pain, and sometimes both together.
때로는 이제 통증 없이 위크니스가 있을 수도 있고 반대로 이제 통증만 나타날 수가 있고 두 개가 다 나타날 수도 있고.
And after this, you perform the passive range of motion testing in these parts which were positive, which hurted in the active test.
그다음에 이제 패시브 ROA 테스트 같은 경우에는 액티브 ROA에서 뭔가 이제 양성이 나온 후에 진행을 하고요.
So, if patient has shoulder pain on the left side and he doesn't reach with his arm the ear, he says it hurts. He makes it 3 times, it hurts. 3 times equal. What make you as next intervention?
자 여기서 귀에 붙이지 못하고 통증이 있습니다. 그리고 세 번, 네 번 반복을 해도 똑같습니다. 이 다음에 이제 다음 스텝은 뭔가요?
Yes. You don't think about it. You have to make the test passive. And if by passively make the test, it does not hurt anymore.
근데 패시브로 하니까 만약 아프지 않았다.
Where is the focus? Where would you look for trigger points?
자, 어떤 거에 이제 포커스를 둘 수 있을까요?
Active muscle, then it's a muscle, it's not a joint. If it passively doesn't hurt, it must be a muscle. And a muscle from which muscle group?
어떤 근육군이죠? 이 상황에서?
An abdomen. And those are
이게 뭐 있죠?
supraspinatus deltoideus. Raise your side and you try to find trigger points in these two muscles, nothing else. Okay. It is as simple. But if it hurts, same patient, it hurts, you make it 3 times, it hurts 3 times. Then you make the passive examination and the same pain arises. What do you know? It could be a passive stretched test or a joint or a ligament that you don't know because it could be the capsule, a ligament, something else, or it could be a stretched muscle. Which muscle groups or which muscle group is probably involved in this problem? The adductors. Which muscles can perform adduction? Adductor. Latissimus dorsi. Teres major. Subscapularis. Very well. Pectoralis. pectoralis major, yes. If you are not sure, it's okay. It's okay to take anatomy book. And every muscle lateral from this axis of abduction can be involved. We have the latissimus, teres major, subscapularis, teres minor, infraspinatus too. And then ventral, it could be pectoralis major. And you see again, too much muscles to know where to start. Too much. So, please again, we have to perform again an examination, and please to the group.
자, 저쪽 알아볼까요?
Like perfect. Please perform this. You have the shoulder pain set on the left side. Yes.
자, 왼쪽에 손상을 받은 것처럼
Okay. So please make this movement. Perfect. Does it hurt? You know this pain?
Yes.
And down. And second. It hurts? Okay. And down. And once again. It hurts? Okay. And down. And now just with the left arm, please. Does it hurt too? Okay. Then I go in this position. And we go away from the pain. Does it hurt? No. I go in this position. Does it hurt?
No.
Yes. Please say yes.
Yes.
Because we said we are now in the second part where it hurts too. And then we know it's a stretched, it could be a stretched muscle from the adductors, latissimus, teres major, teres minor, subscapularis, infraspinatus, pectoralis major. And then I would perform this one or two. Does it change the pain? One or two? One more pain. Which muscle group arises?
Internal.
Internal rotator. Which muscles? Subscapularis, teres major. Please lie on your backside. Okay. If this hurts more, it would be external rotators. We know infraspinatus teres. Okay. If it doesn't change, I would ask, hurts this more or this more? And if this hurts more, it would be pectoralis major. Yes. Okay. I play with these differentiations to get the information in which subgroup of the muscles I have to look for trigger points. Thank you so much. Questions about this?
질문이나
Okay. This we had yesterday. And now it's possible to play a role play in working groups. I have prepared a little quiz. And on this quiz, I have prepared a paper. And on this paper is the name of a muscle, of one shoulder muscle. And the most important part of this game is to say nobody which muscle stays on this paper. This is top secret. Please don't say to anybody else the name of this muscle. Can you keep a secret?
Yes, I can.
I hope so. This is most difficult part of this exercise, not to speak about the muscle. So, you get a muscle, and there are different muscles, and you think a moment about which problem this muscle could perform, making this overview examination with flexion, with abduction, with external rotation, with go back to the low back, to go here, and then to make the resistance movements, resistance testing. And you play just one parameter which hurts. Not every, just one time you say, now it hurts. And then you are in a group with 3. The therapist tries to analyze which muscle it could be. Okay. First you think about which muscle it could be, then you come to me, and I form groups with 3 persons. And in these 3 persons, one is the therapist, one is the client, the patient, one is a supervisor or coach. And then the therapist says, okay, what is your problem? Can we play now?
자, 이제 3일1조로 퀴즈 연습 한번 해볼 거고요. 근육이 이름이 적힌 종이를 하면 여기 근육이 뭔지 다른 사람한테 그냥 말하지 말고 진행을 합니다.
And the patient says, oh, I have shoulder pain. Where? He makes like here, or here, or here. What's your problem? Shoulder pain. Where? Okay. Then I know it's on the right side. He has shoulder pain. Okay. Then I say, please make this movement. Does it hurt? It hurts. Okay. And he can say just once it hurt, but I follow the whole process. I say, okay. Does it hurt? Yes. And then, does this movement hurt? No. Now you have to say no. 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 And does this movement hurt? No. Okay. Then please go back with your hand. Okay. Does this hurt? No. No. And please go in this position. Does it hurt? Yes. No. No. You have to say no. This is a rule of the play, because otherwise it's too complicated. It's just to train a little bit this interrelation. Okay. And then please go in this position and press outside. No. No. Inside. No. Up. Yes. No. No. And down. No. And you go in this position and you press here. No. And here. No. And here. No. Okay. This is the overview examination, and then I have to know, to remember which part was with pain, and I remember first movement pain in this situation. Then I perform as next. I say, please again. Does it hurt? Yes. And once again. Does it hurt? Yes. And in this game, you say 3 times yes. Okay. What do I make as next intervention? Passive. Please make it again. Then I go here and here. Does it hurt? Yes. We go away from this enraged pain. Does it hurt? No. And then we go again in this situation. Does it hurt? It hurts. Okay. So I know it's a muscle which is attached. Okay. It could be a muscle which makes extension. Which muscles do you know which makes extension? Latissimus. Triceps. Deltoid, yes, the dorsal part of the deltoid. Very well. And then you say it is triceps, is it deltoideus, or is it latissimus, which was written on your paper. And you say, yes, it was deltoideus, for example. And then you change, so that each person has each rule. Then you change, and the next came with this muscle on the paper, and so every person plays every role. Do you have questions about the play? The quiz? Okay, perfect.
그러면 3번 하는 건가요? 3명이서 그룹이니까.
Can you play like this 3 times, because we have a group in 3 people in one group?
Yeah, it's no problem. We are 20, probably there will be a group with 4 it's no problem.
아 그렇게 해도 되고 안 해도 됩니다.
한 번만 되겠네요.
그래서 한 번만 해도 됩니다.
Yeah.
그리고 혹시
Either forms of the groups here. If you know what you play, you come to me, and we put the groups new together, and then you can start. You can go to a panel and then you start. Okay, you can take it.
혹시 전체적인 이해 안 되는 부분은 룰에 대해서
한번 보시죠.
자, 일단 3일도 기본적으로 만들어주시고 그러니까 근육 받은 거 있으면은 비밀로 하고요. 그 근육을 맞춰나가게끔 유도를 하는 겁니다, 서로. 그리고 규칙이 있다면 근육 안 하지 말게요. 전제 조건은 3번 다 AR을 테스트했을 때 다 똑같은 통증이 있다고 말하는 거고요.